Hi, I'm Dr. Tarun from Sapthagiri Institute of Medical Science and Research Center, Bangalore. First, about I'm now graduated in the year 2020, and coming to my college, infrastructure-wise, college is good. Uh, I think academic year began in 2011, and I think 3 to 4 batch of PG has already been completed their post graduation. Transport facility is really good. Hostel facility is also okay. Lab facilities are good, and maintenance facility is also good. Coming to the academics, academic in Sapthagiri is really good. The staffs are very much concerned about the students. They help us a lot with any doubts, and clinical wise also they help us a lot in lot of ways. The lab exposure is good in Sapthagiri. And coming on to the practical exposure, yes, we do get practical exposure. Initially, in the first year, we learn anatomy, biochem, and physiology, which is mostly theoretical and little bit of dissection and things. And then when we reached from first year to fourth year, and then we entered during our internship. There was no post-graduation batch studying in Sapthagiri, so we got hands-on every procedure that we do, and we were the only doctors next to the patients. So half our internship, there were no postgraduate students, so we had a really good exposure during our internship. Then, and from past 3 years, super specialty clinics have come up in Sapthagiri, so which gives both postgraduates as well as interns to learn more in each specialties. During our internship, we were posted to major subjects as well as the minor subjects, and the ophthalmology OPD, the ENT, derma, psychiatry, they're all good compared to many other colleges in Bangalore. Hospital patient flow has really increased from my first year to when I was in my internship and my final year. So I recommend the UG students that if you are getting Sapthagiri, it is always better to choose Sapthagiri than to leave and not take and ending up nowhere. Infrastructure wise, yes, definitely it's a new college, so it will not be as good as Ramaya or other KIMS, but definitely it is better than the other private colleges in Bangalore. And lab facilities is good, hostel facilities is okay, and transportation facility is good. One of the best thing in Sapthagiri is the student and the teacher interaction. The staff, they are really concerned about us in every department from anatomy to final year subjects. So we feel like very much free to ask anything what we want to ask to the staff and learn more from them. Coming to library, it is okay. The only place where you enjoy in MBBS is the lab. That is whether it is anatomy dissection hall to your clinicals in the hospital. That is the only place where you spend a lot of time as a student in MBBS, so you enjoy there a lot. The learning is good, that's why, because our time there was no postgraduates, so we as interns could do all the procedure, or we could be assist as a second assistant or as a first assistant to the surgeons also in the OTs, from anesthesia, giving lumbar puncture, to doing the minor surgeries, to deliveries, and taking the ICU care. We did all by our own with no P. In first year is definitely spoon feeding. That is definitely required to learn your basics and make your basics stronger, so that once the foundation is good, you can really build upon it. And coming on to, as we go to second, third, fourth year, it's totally upon us. Once your basics are strong, you can apply the same to any subject, and you can come out with flying colors in all the subjects which you give, both clinical as well as your practicals, viva theory, or anything. The medicine department is having a good exposure. The pediatric was the most hectic department wise, and to learn, yes, anesthesia was something what for the first time we could learn things. And I like derma OPD because I could see good 30 to 40 patients per day, and which helped me learning my basics. And in the ophthalmology OTs, we used to we get to give patients local anesthesia and also help assist teachers in your cataract surgery. And we did did deliveries many a time. That is, even during C-sections we used to get suturing and things, and in ICU, pediatric ICU care of the babies, and also the OPD learning from in every specialty. Initially it was a new college, so hospital patient flow was less, but with more camps and the super specialty coming with the postgraduate courses started in our college, it increased drastically, and now it is good. Yes, I would like to recommend Sapthagiri to my juniors to take up Sapthagiri if you don't get anywhere, but after taking you can learn a lot. And one more thing is, from my college, from my batch, I think more than 7 to 8 people have gone to AIMS and other central institute. So I think that you will know that much we could learn in this institute. To know more about the colleges, do like, share and subscribe Medical Mentors on YouTube channel. Thank you so much.